Assalamualaikum warahmatullahi wabarakatuh. I am Anis Azri binti Abdul Aziz, and today I would like to present about the laboratory diagnosis of Helicobacter pylori infection on patient in Pantai Hospital, Kuala Lumpur. The main objective of this case study is to study the disease and the method used by Pantai Hospital, Kuala Lumpur in diagnosis of Helicobacter pylori infection. So for the introduction to the patient, this is our patient today. This is patient A. The date of birth is 25th of February and born in 1984. The age is 24 years old and the gender is male. The race is Malay. So currently, patient have complained about the abdominal discomfort, burning abdominal pain, bloated and frequent burping. So the doctor has suggested to do the test for Helicobacter pylori test. First, for laboratory investigation is urea breath test. How is this test is done? First, the patient will swallow a capsule containing urea made from an isotope of carbon, and if H. pylori is present in the stomach, the urea is broken up and turned into carbon dioxide. The sample of exhaled breath are collected and the isotope carbon in the exhaled carbon dioxide will be measured, and this is the example of the result and the reference range. The second test is rapid urease test. Rapid urease test is also known as the CLO test, which is Campylobacter-like organism test, which is a rapid diagnostic test for diagnosis of Helicobacter pylori. This test is to determine the ability of H. pylori to secrete the urease enzyme, which catalyzes the conversion of urea to ammonia and carbon dioxide. The third test that will be done in the laboratory is stool antigen test. The purpose of this test is to look for foreign protein, or which is called antigen, associated with H. pylori infection in the stool. If H. pylori antigen is present in the stool, the result will be positive. Stomach biopsy culture and sensitivity test is also done in Pantai Hospital, Kuala Lumpur. A small amount of stomach biopsy will be taken from the patient and sent into the laboratory for culture, and the final result is Helicobacter pylori will be isolated. And as you can see in here, this is antimicrobial susceptibility testing for H. pylori from the biopsy taken from the patient. And as you can see in here, some of them are resistant and some of them are sensitive towards the antibiotics. And this is an example from histology department. And as you can see in the picture, there are abundant Helicobacter pylori and neutrophilic exudate on gemcitabine. For patient medication, the patient has been given levofloxacin for antibiotics and bismuth subsalicylate for protecting from stomach acid. For discussion, how Helicobacter pylori attack? First, the bacteria will attack lining of the stomach, and after that, the stomach acid will get through the lining and getting worse. And for the second discussion, how urea breath test work? As I explained before, the H. pylori will change the urea in the body into carbon dioxide, and after that, the carbon dioxide in the patient will be measured. For histological view, the H. pylori usually will appear as curved, spiral sheet-like in superficial mucous layer and along microvilli of epithelial cell. It can be seen in hematoxylin and eosin staining, and also in special stain such as gemsa stain. As a conclusion, it can be concluded that all the data from the diagnostic laboratory shown a positive result, and the patient is confirmed to be infected by Helicobacter pylori. That's all for today. Thank you for listening to my presentation.